What really happens to your body if you ejaculate every single day? If you're a man over 40, you've probably noticed that your energy, desire, and even your recovery time are changing. But is daily ejaculation helpful, harmful, or just normal? Many men wonder about it quietly, but never bring it up. Not with their doctor, not with their friends, sometimes not even with their partner. Today, I want to talk to you honestly, clearly, and without any judgment. Because your sexual health is part of your overall health, and understanding it can lift a huge weight off your shoulders. Hi, I'm Dr. Mason, a urologist who's been helping men for over 25 years. My goal today is simple: to give you a calm, fact-based explanation of what happens if you ejaculate every day, especially if you're a man in your 40s, 50s, 60s, or beyond. Instead of a simple yes or no answer, we're going to look at how ejaculation affects your hormones, your sleep, your brain, and your prostate, what daily ejaculation might help with, what daily ejaculation might complicate, how age changes your body's response, how to find the right balance for you. Think of this as a supportive conversation, the kind you would have with a doctor who genuinely cares about your well-being. 1. The positive effects of daily ejaculation. Let's begin with the potential benefits. A lot of this part doesn't get talked about enough, especially in men over 40. 1. Mood support and stress relief. Whenever you ejaculate, whether through sex or masturbation, your brain releases a blend of chemicals that help you feel good and relax. Let me put this in simple terms. Endorphins, your body's natural pain reducers; dopamine, the reward and motivation chemical; oxytocin, the connection and calm hormone; serotonin helps stabilize your mood. Daily ejaculation doesn't magically cure stress or anxiety, but it can help you unwind, especially after a long day. For men over 40, many of whom deal with job stress, family responsibilities, aging parents, or health concerns, this brief moment of hormonal balance can feel like hitting a reset button. One patient of mine once said, "It's 5 minutes of peace for the price of $0. And honestly, that's not far off. 2. Better sleep, especially for men over 40. If you've ever felt sleepy after an orgasm, there's a reason. After ejaculation, the body releases prolactin, a hormone linked to relaxation and drowsiness. For older men who naturally experience more sleep problems due to hormonal shifts, this can be surprisingly helpful. The benefits include falling asleep faster, lower sleep-related anxiety, feeling more mentally settled at night. Men over 40 often tell me they sleep more deeply on nights when they have an orgasm, and the science supports that experience. 3. Circulation boost and heart health support. Sexual arousal isn't just below the belt. It creates a brief whole-body reaction. Your heart rate increases, your blood vessels widen, blood flow improves, and your muscles relax afterward. For older men whose circulation naturally slows with age, this improved blood flow can be a small but consistent benefit, almost like a gentle cardiovascular workout. I often tell patients, it's not a substitute for exercise, but it's better than sitting still. 4. Prostate cleansing effect. Here's something many older men never hear about. Your prostate is like a small factory that makes seminal fluid. When it empties regularly, it tends to stay healthier. Research, including long-term studies, suggests that men who ejaculate more often tend to have cleaner, better-functioning prostate fluid. Frequent release may help flush out old cells, reducing irritation. This doesn't mean daily ejaculation prevents prostate cancer, but it can support prostate health in general. For men over 40, this is especially important because the prostate naturally enlarges with age. 5. Immune system support. Some small studies have shown that orgasm can temporarily increase certain antibodies, essentially giving your immune system a quick boost. On top of that, since chronic stress weakens the immune system, Anything that helps your body relax, even for a short period, indirectly supports your ability to fight off illness. I like to explain it this way. A calm body is a stronger body. If ejaculation helps you relieve tension, unwind, and release pressure, your immune system benefits from that reduced stress load. 2. The possible downsides of daily ejaculation. Now let's take a calm and honest look at the other side of the conversation. Daily ejaculation is not automatically harmful. For many men, it's perfectly normal. But depending on your age, emotional state, and habits, it can create challenges. Understanding these possibilities isn't about shame or judgment. It's simply about being aware of how your body and mind respond. 1. It can become a compulsive habit. There is an important difference between "I enjoy it" and "I feel like I have to do it." For some men, especially those dealing with work stress, loneliness, or emotional struggles, ejaculation can start as a simple stress reliever and gradually turn into a reflex. Instead of being a choice, it becomes automatic. When that happens, you may notice you feel guilty afterward. You hide the behavior from your partner. You rely on it to avoid dealing with emotions. You feel irritated or anxious if you skip a day. This isn't about the act itself, it's about losing the sense of control. Compulsion can sneak up slowly, and many men don't recognize it until it starts affecting their relationships, energy levels, or daily routine. The goal here is not to stop, it's to help you make sure the behavior stays intentional, not reactive. 2. Using ejaculation as an emotional crutch. A lot of men in their 40s, 50s, and 60s carry emotional weight, pressure from work, financial stress, health concerns, or feeling disconnected from others. Ejaculation can provide a quick moment of relief. It temporarily softens anxious thoughts and slows down the nervous system. There's nothing wrong with that when it happens occasionally. The problem comes when daily ejaculation becomes your primary emotional outlet, the main way you soothe stress, sadness, or boredom. When that happens, it can replace healthier strategies, such as talking to a friend or partner, exercising, getting outdoors, practicing relaxation or breathing techniques, addressing the root of stress directly. I've had many men tell me over the years, it helps, but only for a moment. That's the key. The emotional relief doesn't last, and the underlying problems stay untouched. When ejaculation becomes a bandage, it might feel comforting in the moment, but can add up to long-term frustration. 3. Lower sperm count. If you're trying to have a child, this point matters. Your body needs a couple of days to fully replenish sperm levels. Daily ejaculation won't harm your health, but it can lower the concentration of sperm in each release because the body hasn't had time to fully rebuild. Most fertility specialists recommend having sex or ejaculating every 2 to 3 days when trying to conceive. This tends to produce the highest sperm count and improves the odds of fertilization. If you're not trying to have children, this effect usually doesn't matter at all. 4. Reduced libido or mental fatigue. This one surprises a lot of men. When ejaculation happens too frequently, desire can sometimes go down instead of up. This is especially true as men get older and the body requires more time to recover. Here's why. The brain becomes used to constant stimulation. Dopamine, the reward chemical, becomes less responsive. You may need stronger stimulation to feel the same excitement. Your refractory period, recovery time between orgasms, becomes longer. Many men in midlife notice that daily ejaculation leaves them feeling mentally foggy or physically drained. This doesn't mean anything is wrong, it simply means your body may need a slower rhythm as you age. 5. Training your body to finish too fast. This is one of the most common issues I see in men who ejaculate quickly and frequently, especially through rushed masturbation. Your nervous system learns from repetition. If you consistently rush, use a tight grip, try to finish quickly, use intense stimulation, your body begins to treat this as the default setting.
Later, during intimacy with a partner, you may finish sooner than you want, feel disconnected from your partner's pace, worry about performance, and experience difficulty staying firm. None of this means you're broken. It simply means your body has adapted to the way you've been stimulating it. The good news, with slower, more mindful habits, you can retrain your system at any age.
3. Age matters, especially after 40. Ejaculating every day at 20 and ejaculating every day at 45, 55, or 65 are simply not the same experience. Your body changes as you age, and so does the way it responds to sexual activity. This doesn't mean anything is wrong, it just means your biology is different now. After 40, most men naturally go through several shifts. Testosterone production begins to slow down, which can affect energy, mood, and sexual desire. Recovery time after orgasm becomes longer, so you might notice you don't bounce back as quickly as you used to. Many men also carry more stress in midlife. Work pressure, family responsibilities, or sleep issues, all of which influence sexual stamina and interest. The prostate also tends to enlarge gradually with age, and while this is common, it can make ejaculation feel different than it once did. Blood flow to the penis decreases slightly over the decades, and nerve sensitivity changes as well. All of this can alter how often you want to ejaculate and how you feel afterward. Some men find that daily ejaculation gives them a sense of vitality and relaxation. Others say it leaves them tired or less interested the next day. Both reactions are completely normal. What matters is listening to your own body. 4. How to know what's right for you. One of the most important things I tell my patients is that there is no universal rule for how often a man should ejaculate. Every man is different. Your age, your health, your stress levels, your relationship, and even your personal preferences all play a role. What matters most is understanding how your body responds and making choices that support your overall well-being. Over the years, I've seen many older men do perfectly well with daily ejaculation. It can be beneficial if it leaves you feeling balanced rather than drained. Daily ejaculation may be right for you if you feel relaxed and content afterward, you notice you sleep more easily, you're not using it to avoid difficult emotions, your desire stays steady throughout the week, you're not guilty, pressured, or obligated to do it, it doesn't interfere with your relationship or your daily responsibilities. When these conditions are met, daily ejaculation can be a healthy part of your routine, but it's equally important to recognize signs that daily ejaculation may not be serving you well. Pay attention if you feel tired, foggy, or unmotivated afterward, your libido seems lower than it used to be, you find yourself rushing through it every time, you're dealing with erection difficulties or inconsistent performance, you're using ejaculation mostly to numb stress or escape uncomfortable feelings, you're feeling trapped in the habit rather than choosing it, you and your partner are trying to conceive and need higher sperm concentration. If any of these apply, adjusting your frequency, even slightly, can make a meaningful difference in your energy and confidence. Think of your sexual health the same way you'd think about exercise. Too little can leave you tense and sluggish, but too much can wear you out. The key is finding the middle ground where your body feels restored, not depleted. 5. Practical tips for men 40 plus. Here are 3 simple practical steps I often recommend to men in their 40s, 50s, and beyond. These aren't complicated routines, just small adjustments that can support healthier, more enjoyable sexual function. 1. Slow down. If you ejaculate every day, try giving yourself a little more time rather than rushing through the experience. Many men fall into fast, automatic patterns without even realizing it. especially when dealing with stress or when trying to be discreet. Slowing down helps your body unlearn these rushed habits. This alone can improve control, reduce the tendency to finish too quickly, and make the entire experience more satisfying. It also helps reconnect your mind and body, which becomes more important as you get older. 2. Take 1 to 2 rest days each week. Just like your muscles need recovery days after a workout, your sexual system benefits from a brief pause. Taking 1 or 2 days off each week allows your nervous system to reset and your desire to rebuild naturally. Many men are surprised to find that even a short break increases sensitivity, boosts libido, and restores energy. It's not about abstaining, it's about giving your body a chance to recharge. 3. Strengthen your pelvic muscles. Simple pelvic floor exercises, tightening the muscles you would use to stop the flow of urine, can work wonders. A few minutes a day improves control, stamina, blood flow, confidence. These exercises help men of all ages, but they're especially effective after 40, when natural changes can affect firmness and endurance. Conclusion. So what truly happens if you ejaculate every day? The honest answer is that it depends on your body and your situation. For many men, especially those who feel relaxed and balanced afterward, daily ejaculation can be a perfectly healthy part of life. The good news is that daily release can offer several benefits. It may lift your mood, help you fall asleep more easily, support better blood flow, keep the prostate active, and serve as a natural way to reduce stress. For some men, it even contributes to a sense of emotional balance and well-being. But there are also reasons to be mindful. For certain men, particularly those over 40, daily ejaculation can sometimes lead to decreased desire, emotional avoidance, quicker climaxing, fatigue, reduced sperm count, or even performance anxiety. None of these means something is wrong with you. They simply suggest your body may need a different rhythm. Ultimately, there is no universal right number of times to ejaculate per week. What matters is listening to yourself. If daily ejaculation supports your life, there is no harm. If it begins to drain you or interfere with your confidence, it may be time to adjust. And remember, if you ever have concerns about your prostate, erections, fertility, or desire, reach out to a doctor. You deserve guidance without shame or embarrassment.